Hi, everyone, and welcome to Ticked Off, a series where we explore everything from chronic illnesses and healing to pet care, outdoor adventure, and wellness tips for living your best life. I'm Olivia Abrams, the founder of TickMit and your host for this series. Whether we're chatting with veterinarians, wellness experts, or passionate outdoor enthusiasts, our goal is to give you actionable insights and real stories that inspire and empower you. Let's dive in and meet today's guests. Dr. Heather Magnuson and Mike Natal, owners of the in-home clinic Opulent Health. Heather's background in emergency medicine has fostered her deep compassion for clients and patients, while Mike's extensive experience in at-home veterinary care and contributions to leading industry publications make him a trusted voice in pet health. Both share a love for the outdoors and a commitment to improving their lives of pets and their owners through innovative care and education.
Okay. Hi, Mike and Heather. Thank you so much for being here with us.
Hi, thank you for having us.
My audience has so many questions about ticks and tick and flea medication and tick safety. So I would love to ask you, can you tell us a little bit about how ticks can have an effect on your pet's health?
Yeah, so I'll take over this one. So basically ticks, there's a first off, there's a lot of different ticks out there, and they're all in different regions of I guess we could say North America, stick to that. We're located here primarily based in the Northeast. So one of the big ticks that um, is Ixodes. It carries something called Lyme disease. And that is probably one of the biggest threats to dogs' health. So what happens with Lyme disease is it mainly can cause a bunch of different clinical signs, but the first one that we, as a veterinarian, that we look for is shifting leg lameness. So that's when one day a client will come in and be like, "Oh, my dog's front leg is hurting. He's really favoring that leg." Then the next day he thought that it was the back leg. So when I hear that in the history intake, or when I see, he's lame on a leg, I will then, think immediately about Lyme disease. Another big thing that it can cause is a fever, so increased temperature. It can also cause a bunch of different other symptoms, though, because especially originating from that fever, they can get decreased appetite, vomiting, lethargy, things like that, especially if the Lyme disease causes issues and the bacteria starts to affect the kidneys. So we call that Lyme nephritis. That's when it's very scary because it can be life-threatening. And when it gets to that point, Lyme nephritis causes acute vomiting, again, lethargy, and it can also cause urinary issues.
Mhm. Yeah, and unfortunately, we've had a number of people tell us that their dogs or their cats or even their horses, have passed away after being bit by a tick. Is that something like an instance where Lyme disease isn't caught very early and it progresses, or do you think that could typically be a different kind of tick-borne illness?
Sometimes it can be, from Lyme disease, but there's other diseases that ticks can carry, like Ehrlichia, Rocky Mountain spotted fever, for example. But it really depends on the region and what kind of tick bit the patient. So, you know, again, here on the Northeast, Lyme disease is probably the most prevalent
Mm.
and the scariest one over
Yeah.
here.
So when you get a new patient, and by patient I mean animal, coming to see you and they are curious about different types of flea and tick preventatives, such as oral medication, topical, collar-based, how do you kind of walk them through what's the right decision for them?
So I think that is all patient client specific. Everyone reacts differently. Every animal reacts differently to each topical or collar. or oral medication. So I think that's a big factor that we have to consider, along with what other animals or even children are in the house, right? Because cats can be very sensitive as well to some topical flea and tick medications. So we have to keep that in the back of our head when we're recommending this, along with children, right? If we're using a topical and there's little kids in the house that are petting the dog, we want to make sure that those little kids are not maybe petting that dog and then sticking their hands in their mouth.
Frontline, Vectra, Canine Advantix, those are, they're great, but if there is a cat in the house, they contain permethrin, which is very, very toxic to cats.
Yeah.
The other thing is there's also Seresto collars out there, which are great, again, because they tend to last longer and people don't have to give like monthly or every 3 months, like tablets. So they keep the collar on, but an issue with the collar sometimes is that they don't tie the collars too tight or they leave it on for too long. So it's not as effective after a while.
Right. Yeah, I've been in a number of like Petco's, PetSmarts looking at the flea and tick medications, and so many of them are like, you can't use this on a cat. And so it was really interesting to hear why that is. I've always been so curious.
Yeah. Yeah, permethrin and pyrethrin. So permethrin is just kind of a more synthetic component of that, but they're deadly and toxic to cats.
Yeah, and that's a really great thing to note because permethrin is in a lot of different bug sprays that humans use. And so if you do have a cat in the house, it's definitely something to take note of.
Yeah.
Yeah.
Can you talk a little bit when it comes to the oral versus topical versus collar? How exactly does that affect the tick?
So when the tick does have to actually like bite the patient, bite the dog or the cat, for them to get exposed and for the bacteria to transmit into the patient. So the different products, some of them like NexGard and Bravecto, the isoxazolines, they don't actually prevent the tick from attaching, but they kill the tick once it is attached. And the good thing is that they have a quick kill time. So some of them, actually prevent the tick from attaching, more like the Canine Advantix and the Vectra ones. They prevent the tick from attaching itself. But there's two different kind of categories. Like either they attach and then they kill because that medication is within the system versus preventing tick attachment.
So you would say like the topicals and the collars are more around preventing the tick attaching, and like an oral medication would kill the tick if it does attach.
So it really is kind of dependent again. But then the oral ones, they usually more are kill. So they don't prevent the tick attaching, but once that patient ingests the medication, and the tick's attached, it will kill the tick. So the tick may still be attached, but then it'll like kill the tick and stop it from, getting in its system.
Mm-hmm. Okay. Yeah. And then when it comes to, I guess, the long-term, usage of these different medications, is there something that you guys recommend? Are there like certain symptoms that you might see in a patient who's using these medications that would cause you to take them off the medication and switch them to something else?
There's a lot of people who say that you can stop taking or giving, I'm sorry, flea and tick medicine to your pet during the winter times. That is not recommended. We recommend that you should be doing it year round. Fleas and ticks are still out there. All other parasites really are still out there, but ticks can still latch on. They are going to try getting into a warm place. So, with that being said, they could, in theory, jump onto you and in result, jump onto your dog once you get in the house. With that also being said, though, I don't know where, all the listeners are coming from, but here where we're from, we live close to the beach. I bring my dog to the beach all the time where there's tons of fleas and ticks. And the ticks will still jump on the dog there. So I think the important thing for the listeners to do is, even if it's winter time or the summertime, if you're taking your dog out and about to dog parks or, the beach, definitely do a nose to tail assessment, looking underneath the armpits, by the belly area, underneath the paws, by the ears, because that's where these ticks will tend to live. And again, removing those as soon as possible is really, really important.
Yeah.
What should you do if you find a tick attached to your dog?
So, yeah, so if you feel comfortable, you should be taking the tick off. And the important thing about when you're removing a tick is we always recommend tweezers, something that usually everyone has at home, and always making sure that you're getting the head or, the mouth portion of the tick completely off. If you don't feel comfortable, we always recommend go to your vet. They can definitely assist you with that, with taking those ticks off.
Mhm. And is there any time, maybe if your dog isn't on flea or tick medication, or just maybe if someone else in the home has experienced Lyme disease before, that you recommend people saving the tick and sending it out for testing, or, making sure that if the dog did get bit, that eventually you are testing them to make sure that they're not, getting any symptoms?
Yeah, so you can definitely send the tick out to the lab. What I would recommend is definitely, if you're in the Northeast area, is getting a 40X SNAP test. So it's actually a blood test that you can get. I usually tell my clients to test their dogs or their cats 4 to 6 weeks after they find a tick on their baby, because it takes time for the antibodies to develop. So the test might not be the true response if you do that test too soon.
And if you do find that your dog or your cat tests positive for Lyme disease or any other tick-borne disease, what is the typical course of treatment you recommend?
Yeah, so usually we recommend a 30-day course of doxycycline, which is an antibiotic, but that is the standard medication.
And that's the standard medication for humans too, is doxycycline. So you can, if you have some in your house, you can give it to your dog too.
Yeah.
Before we sign off, we like to ask every guest, whether it's, veterinarian related or not, what is one thing that ticks you off, big or small, rational or irrational? Let everyone know.
You want to go first?
You go. You go.
What ticks me off the most is honestly getting ticks when I'm at the beach, because I get disgusted from them.
Yeah, I mean, I would have to agree. Like when I was little, I used to get ticks all the time because I'd play sports a lot. And still, I used tick mitt actually on myself recently. I was in the woods and I was running through the woods, and my hair and my ponytail, I had a tick, and it actually came right off because I just didn't want to touch it with my hands. I'm so used to using gloves and forceps, but when it's on yourself, it's different than on a patient. But the tick mitt helped a lot actually, and I was really impressed. But yeah, I have to say, getting ticks on myself.
Yeah.
Yeah.
I'm so glad to hear that. I hate ticks too. I don't like touching them at all.
Yeah.
Well, thank you again for tuning in, and don't forget to follow TickMit for more insights, stories, and tips. Until next time, take care and check yourself.